Hi, everyone. My name is Mike Tiffany. I'm Arcadia COO, and I'm here to spend a few minutes today talking through a recent study that HIMSS did in combination with Arcadia around trends in interop, AI, and value-based care strategies. So this is the third year that Arcadia has sponsored a non-biased research study from HIMSS, where we're looking at provider organizations, VBC strategies, how they're using data, and how they're adopting AI. With this goal really is to give you a view of leaders, where leaders are within the provider organization, and then allow to really see the trends in the industry and where we're headed. I won't go through all the key takeaways, but what you'll see here, data is driving insights. It's driving people's VBC strategies. There's a lot of work that people are contemplating around how they do more collaboration with payers, but there's some disagreement around how to get there and the right way to approach it. And AI is everywhere, but it's still really early. So I'll dig into each one of these across 5 of the questions that were in the research study. This study, the full study, comes out in Q2. This is a preview, and if you scan the QR code at the end, you'll get access to last year's report, all of the slides from this year, and then you'll be able to sign up to get a notification when the new report is available in the April timeframe. So first, how are provider organizations using data? What are they using that data to enable right now? And so this year, really nothing that's surprising at the very top. Improving quality of care, cost containment, care management and coordination, kind of the fundamentals. We'd be surprised if these weren't sitting up top. I think the interesting thing is, as we're working with a lot of our customers that have been working through their value-based programs and strategies for several years, we see a lot of the ones on the right-hand side of this table that are becoming increasingly important to those organizations. Specifically calling out health equity, SDOH, avoidable ED visits, and preventative care strategies. So they may be at the bottom here, but there's probably, we think the reason is, first, we asked for their top 3 ranked programs. And so you're still handling a lot of the fundamentals here. And different groups are going to be in different places in their VBC journey. How many years are they into doing this? How much have they refined their programs? And then lastly, there's a really interesting difference that you'll see in the full report around large organizations versus small organizations. If I was to look at chronic disease management for a large provider organization, over 7,500 employees, that's over 20% ranked that in the top 3. Small organizations, less than 5% rank that in the top 3. And so again, it also gets to a resource challenge. And in certain organizations, having to make a choice around where you're going to spend your resources along these programs. Second, when you're using the data, where have you seen improvements via the use of that data? And so not necessarily just where are you using it, but where has it driven the most improvements within your different programs? And so, again, left-hand side, not overly surprising. The performance management, operational efficiencies, and patient and provider engagement. The right-hand side, there's a couple interesting things here from my perspective. When you think about the risk-based, whether it's savings or bonuses, this gets to that very difficult next step of, I can now measure my performance. I now know how to engage my patients, and I know how to engage my providers. I have not necessarily figured out or optimized how to pull the results through on my contracts via that engagement of patients and providers. And this is the behavior change, both for your patient population and your providers, and thinking through how do you make this easier for each of those different communities to integrate this into their normal daily life or their normal workflows. On the network management and contract management side of things, we've seen this for a while. There isn't a good comprehensive tool set that gets to really helping people in these topics. It was a large thesis around our combination of the Care Journey and the Arcadia teams last year, was really helping to give our customers tool sets and data sets that give them the best available data to make those network optimization, those contract management decisions via just very comprehensive first-party and third-party data all in one place. And so that's been really helpful. And you'll hear talks from some of our other team members on this over the next, over yesterday and today. And so moving a little bit away from data, when we ask the customers, or we ask, organizations, when we've surveyed organizations, what are the initiatives you're launching? Where are you focused going forward? Care coordination, chronic disease management, some the two big high level ones kind of outpace everything else. But again, this was asking for top three. And what you see here is similarly to earlier, SDOH, risk capture, network adequacy, specialist integration. Lower down, we hear about them every single day from our customers, especially the ones that have been running programs for years. They've optimized a lot of their PCP base. They're trying to think about how do they get out, using specialists as an example, how do they get out to their specialist communities and incent them to be interested in taking part and help them share in the results via incentive programs. Getting to that specialty conversation, you would expect to see primary care and cardiology be the places that they're the most invested in. Really long tail, which, no common theme here, really long tail here. But what you see is, if you looked at this last year to this year, you're seeing more and more groups be able to say, we're focused on our specialist communities. And that's where the opportunity is going to be as we've optimized our PCP networks. A good example, if anybody was here yesterday, and you can get the presentation as well off of the QR code at the end, we had one of the leaders from care management at Wake Community Care in Raleigh, North Carolina, talking through, they launched what they call their high-value provider, the high-value specialist program, where they found specialists within their network, within the community, who wanted to take part in developing that high-value network, and were able to then pull those specialists together, use the data via Arcadia, work with us to pull insights out of that data, and help them understand the opportunities. And they gave a great example of having a large dermatology specialist network and seeing that the pathology lab costs and satisfaction scores were not where they should be from the patients. And they were able to dig into the data, realize they were using pathology labs, specialty pathology labs that were outside the community, sometimes out of state. It was driving higher costs. It was driving longer turnaround times for that person to get the results back on those labs. And so they could engage their community. They could help make sure they understood there was a local option that hit the cost, quality, and availability criteria, and help change those behaviors to both improve the cost of care and to improve the overall patient satisfaction with them being able to get their results. This is an interesting one, and it takes a minute to wrap your head on, but we asked HIMSS asked provider organizations, where are you focused on collaborating with payers, and who should own that program? Should it be equally owned between the different parties? Should it be provider owned, or should it be payer owned? And some places, example being data sharing, very clear alignment. Equal opportunity. Payer and providers are both equally responsible for owning that, and that's where the most people believe that's the case. What's interesting is then you dig down into one like care management, where it's pretty broken up. Over 50% think that the provider should own it. Around 40% think that it should be dually owned. But there's no clear agreement. And when you take a step lower in the full study, what you see is that in that care management, if you asked an executive, a finance executive, a CEO, a finance executive, or a data analytics executive, 60% of them would have said that it should be equally owned. If you ask the IT leadership, 30% said that. There's misalignment within the organization around the approach and how to partner with payers and collaborate. That's got to get aligned before you're really going to be able to have a good strategy for engaging those payers. And then lastly, with every presentation at HIMSS, AI. So where are people using AI today? It's kind of spread everywhere. It's not one of those ones where there's a single place that you see the bulk of usage. As I looked at this, the administrative side of it, the predictive analytics, very easy first use case. The other side of this is the chart summarization and the care coordination. We think of this somewhat as kind of the co-pilot technology. How do you make your care coordination, your care management teams, your providers in the workflow more efficient by serving them up clearer, shorter pieces of data that they don't have to read through an entire chart? And so these are places where we've seen good uptake and not a lot of pushback around the value and the role that AI plays in those given areas. What you also see, though, is there's still, whether you're just talking to an organization or you're seeing it in a survey, there's hesitancy to inject AI into the actual clinical workflows still. It's early. People haven't developed that level of trust yet. We think over the next few years, you'll see the personalized patient care plans really start to pull up here with a focus on how do we develop better care plans, provide better care for patients, and how do we use AI, machine learning, and better data aggregation opportunities to help pull that program forward and make it more effective. So much more in the actual full report, but the data strategies remain really important, and we expect to see those more specific, less foundational competencies continue to trend up each year as we see this study. And AI, it'll be interesting to see in the second year, where this is the first year we've asked this question, be interesting to see next year where this ends up. Scan the QR code. That will get you access to last year's report, all the presentations from this year, and then allow you to get notified for this year's report when it comes out in Q2.